Why do you think India's public healthcare services are subpar? Maybe because of the high population density? Or you think the government isn't using the taxpayers' money well? Or 100 other different reasons? The truth is, the issue isn't as simple as we'd like it to be. And sometimes it's better not to worry about why the problem started, but instead work towards a better future, which is what my team and I at Project Auxilia have been working on for the last 2 months. Now, improving healthcare is a pretty vague thing, so you might be thinking, what exactly are we doing to improve the situation? I'll get to that in just a minute, but first let's talk about why and how rural areas are suffering. In a 2018 NITI report, allegedly over 75% of Indian rural households don't have access to clean and safe drinking water. From 2014 to 2019, deaths due to heart attacks have increased by 40%. And one fact that truly broke my heart was that 80% of suicides that are related to drug abuse or substance abuse occur outside of major cities, where prevention programs numbers are scarce or even non-existent. Although I had no personal attachment to healthcare specifically, growing up outside of India where public healthcare was always reliable and sufficient, I was shocked to see the gap between countries like the USA and India in that regard. After hearing stories from the Tirupatalu community, it also put my privilege and assumptions into perspective. We talked to over 30 villagers, and to my disbelief, every single one of them brought a new angle, new information about how we can modify solutions to make sure it affects them the best way possible. After this entire process, we were able to finalize the solutions and begin on how to implement them. First, conduct awareness sessions in the village, teaching topics that we feel are the most predominant. To choose these topics, we asked 6 local doctors that work in the surrounding area what issues pop up the most. The 3 current topics are cardiac health, substance abuse, and waterborne diseases. That's not all we want to do though. We are also combating the insufficiency of water in the village. Lack of clean drinking water is another huge problem, because here, on average, a family of 4 must survive on 20 liters of water for 3 to 4 days. At best, in major cities, we use 5 times of that in 1 day. We are going to provide methods to purify the current water source into drinkable water. We had the problem narrowed down, and that was great, but how are we going to implement this during COVID times? That's where the true power of 1M1B and the Purpose Academy came into play. With amazing support from our on-ground team and input from our teaching faculty like Mark, Elizabeth, and Sudhir, we were able to make action plans and systems map to clearly define our goals and steps we need to take to reach that aspiration. On the topic of what I learned from the Purpose Academy, I think the biggest learning that changed me as an individual and an impactor would be to always put my best foot forward. I used to be the person who wanted to get things done efficiently and fast and waste no time. But the extent on which I worked at presentations, social media posts, and our solutions in general, it showed me the difference between the quality of when I put my full effort into something and I fully try, compared to when I'm doing it for the sake of doing it. In the future months, we will strive to expand and reach out to the neighboring communities and spread our impact even further in West Godavari to ensure that preventive healthcare becomes a part of their lives. If you'd like to help me and Project Auxilia in this cause, please do contribute to our fundraiser in the description below and check out our social medias on screen. For any questions, you can email us or message us on any of these platforms. Thank you.